Hi everyone. In this video, we're going to discuss nursing assessment and interventions and how they coincide with bowel function and elimination. Before we look too deep, we need to recognize there are factors that will affect bowel function. The first is the developmental stage of an individual. Bowel elimination patterns change throughout the lifespan. Some personal factors may include privacy or sufficient time to have a bowel movement without feeling the need to hurry. Stress also has a major influence on motility of the GI tract. It can cause diarrhea or constipation. Nutrition and hydration also play a major role. People who eat on a regular schedule and have an adequate intake of fiber are more likely to develop a regular pattern of defecation, as this promotes peristalsis. A minimum of 6 to 8 ounce glasses of fluid per day are required to promote healthful bowel function. Inadequate fluid intake or excessive fluid loss, as in diarrhea or vomiting, slows peristalsis and leads to dry, hard stools that are difficult to pass. Physical activity also stimulates peristalsis and bowel elimination. All oral medicines have the potential to affect the function of the GI tract. Surgery and procedures that manipulate the bowel may result in a paralytic ileus, which is a cessation of bowel peristalsis. Although peristalsis halts, the bowel continues to produce secretions. Without peristalsis, secretions remain stagnant, causing distension and discomfort. To decrease the complications of a paralytic ileus, patients who have had bowel surgery typically have an NG tube with low constant or intermediate suction. The NG tube removes the secretions until peristalsis returns. The growing uterus during pregnancy crowds and displaces the intestines. Increased level of progesterone slows the intestinal motility. Pregnant women often experience constipation, decreased appetite, and irregular food intake. Pathological conditions that affect bowel function can include both neurological or cognitive conditions. Because bowel patterns vary, you will need a nursing history to determine what is normal for each client. As you interview clients, pay attention to their reactions to your questions. Many people are embarrassed about discussing bowel function. Tailor your assessment to the client's needs and use language that makes the client feel comfortable. Obtaining a home medication list is an important part of the assessment, as many different drugs will affect the GI tract, elimination, or stool appearance. Physical assessment for bowel elimination includes examination of the abdomen, inspection, auscultation, and palpation, the rectum, and the anus, as well as characteristics of normal or abnormal stool. Observe the size, shape, and contour of the abdomen and listen to bowel sounds. You might also inspect and palpate the anus and rectum for the presence of stool or masses. As with everything in nursing, if it comes out of the body, we want to look at it. Assessing stool consists of color, shape, consistency, and odor. For example, the shape of the stool should be a diameter of the rectum. Variations of shape include potentially a narrow pencil-shaped stool, which could help identify intestinal obstruction or rapid peristalsis. Small marble-like stools identify slow peristalsis. Normal odor is usually pungent and affected by the foods eaten. However, strong, foul smells may indicate blood in stool, especially in the upper GI tract, or potentially infection. Using the Bristol stool chart can help identify other potential issues within the GI system. This chart looks at both shape and consistency of stools. The color of stool can also be an indicator of GI complications. As you can see here, malabsorption of fat leads to pale fatty stools. Use of iron medications, high intakes of green leafy vegetables, or GI bleed can lead to black tarry stools. White colored stool may indicate an absence of bile. With all of our gathered assessment data, we can begin to identify potential nursing diagnoses for our clients. Some common nursing diagnoses related to bowel function include bowel incontinence, which is the change in normal bowel habits characterized by involuntary passage of stool. Then we have constipation. Because frequency of bowel elimination varies, constipation is usually defined as a decrease in the frequency of bowel movements, resulting in the passage of hard, dry stool. Constipation can be a temporary problem wherein symptoms resolve in a short time. Nearly everyone has experienced constipation at some point. Breaking down constipation a little further, we have chronic constipation. This typically lasts 3 months or longer and may persist for years. Unrelieved constipation may eventually result in a fecal impaction in which dry, hard stool lodged in the rectum cannot be passed. Then there's risk for constipation. This is an appropriate diagnosis for clients with an increased risk because of bed rest, medications, or potentially surgery. Perceived constipation is an appropriate diagnosis for a client who makes a self diagnosis of constipation and uses laxatives, suppositories, or enemas to ensure a daily bowel movement. Diarrhea is the passage of loose, unformed, or watery stools. Dysfunctional GI motility is a broad label that encompasses increased, decreased, ineffective, or absent activity. If you use this label, you need to specify whether the GI motility is increased or decreased. Toileting self-care is impaired ability to perform or complete your own toileting activities. Risk for impaired skin integrity is generally related to the incontinent client or client with diarrhea. Each nursing diagnosis has related outcomes that will allow the client to reach their goals of normal GI function or symptom resolution without further complications.